I'm Blaine Nickeson. I'm the Chief of Safety and Communications for the Auraria Higher Education Center. One of my primary roles is being the spokesperson for any sort of campus-wide impact, whether related to police things or related to sort of other types of concerns.
Okay. So after the first town hall, there's been a lot of questions that have been raised, and I think the dynamic, the line of questioning has been really centered towards demonizing AHEC. And I think there's a human element that needs to be talked about because people at AHEC are people too. So saying that, I'm going to ask some questions about you guys and what you do.
Sure.
So what is AHEC and what does AHEC do?
So AHEC is a state organization or state agency that is charged with owning and operating the Auraria campus for the benefit of our three institutional partners. So we own the bulk of the buildings, except for things like Student Success Building. We manage all the functions on campus that it doesn't make sense to have three of, right? So we don't have three groundskeeping departments, police departments, things like that. So we're really responsible for making sure that when students, faculty, and staff show up for work or to learn, that the classroom environment is ready to welcome them and that the campus is here to really support that academic mission.
What's the staff of AHEC look like?
We have about 350 full-time employees. The bulk of those are in our facilities department, everything from custodians to plumbers to groundskeepers. And then we have, obviously the campus police department's about 50 people on campus. And then throughout the year, it ebbs and flows, but we employ a lot of students on campus through things like our parking operation, the bookstore, early learning center. So at any one time, we might have, say, another 250 student employees on campus.
So regarding West Classroom,
Sure.
regarding asbestos more so,
Okay.
how long has AHEC known about asbestos on campus or lead in pipes? Not saying that there is, but how long has this been a concern?
Well, asbestos is a concern in any building of a certain age. The buildings that you go to church in, that your kids go to school in, office buildings, pretty much any building that was built before the late 80s likely has some kind of asbestos-containing material in it. That could be mastic in the drywall, it could be glue with the floor tiles. Asbestos was a really commonly used product up until the 80s, and even still, there's still some products that are exported out of Canada, for example, that use asbestos. We know that whenever we're going to be going into buildings and doing work and touching things like flooring or walls or pipes, that we need to do pre-testing for asbestos. And if we determine that those areas do have asbestos, we follow state-mandated environmental remediation processes to do that. So sometimes when you go by a building and you see that there's plastic tenting or things like that around an office suite, you should actually feel good about that. It means that the right steps by professionals are being taken to make sure that that area is safe and that it's left better than it was touched.
Absolutely. Has AHEC been directly involved with comforting individuals, obviously not naming names, but they have been involved with comforting those diagnosed? Have they been?
So our CEO, Colleen Walker, has been involved with leadership from MSU Denver in some of those initial meetings with department staff and really just being there to show that we're taking these concerns seriously, that we're working in partnership with MSU Denver to make sure that there's no questions about the safety of our buildings. And we've also been reaching out to our own staff because we have staff that works in every building on campus. And it's important for us to make sure that they're being informed and that they understand what's happening on campus as well.
So most of the focus has been on MSU Denver. That's primarily an MSU Denver building. But has there been any comment or concern from UCD or CCD about this?
So CCD doesn't use the West Classroom at all. So they haven't, other than sort of just being concerned about making sure that if their folks have questions, there's somewhere they can turn. CCD hasn't had a lot of stake in what's been happening in that building. CU Denver does have 3 classrooms in the building. They're not being used over the summer, but they do have 3 classrooms. And so obviously they've been very interested in knowing if there's any kind of concerns about the building so that they could make plans for the fall semester as well.
And there was something stated in the original town hall meeting that there are known asbestos zones, quote, asbestos zones, on campus. Is there a way to make that public?
I don't know the particular information about what known zones there may be on campus, but again, as I said earlier, many of the buildings on campus, the bulk of them being built before the late 80s, are all going to have asbestos in them. Asbestos in and of itself is not dangerous unless it's made friable, so it's put into the air in some way. It's important for us to know where those zones are. We keep records of every place we've tested so that, again, when we go in and do a renovation project, when you want new carpet and paint in your office, when you want to move a wall or things like that, we want to make sure that we know where all those zones are. But in general, people should assume that within their building there is likely asbestos in there and that it doesn't cause any concern for their health or safety.
Saying that, there has been renovations to the physical education building, and it's taken a little bit longer than what was previously anticipated.
Sure.
What are the major concerns, and why is that taking longer?
So I'm not familiar with the actual project work that's happening. I'm not a project manager in that area, but I know that everybody's doing their due diligence to make sure that projects are completed safely and correctly. Obviously, sometimes we go into a project on campus and we may not know what the existing conditions are, right? So we get into a ceiling and all of a sudden it's different than what was expected from the design standpoint. And so that's a chance for everybody to hit the pause button, to bring in any testing that needs to be done or any engineers or architects that may need to think differently about how they move forward with the project. But certainly at no time is there a time where we would ignore safety concerns in order to speed up a project or move things along. We want to make sure that we're following those procedures that are dictated by the state and by best practice.
So, and staying with the goal of this interview, talking about the human element and why people should really think objectively when thinking about this topic. How has the AHEC staff themselves been affected, and have they really been changed by how this event's occurred?
You know, I don't think so. Obviously, our staff is concerned about our campus community. We're here to serve, and that's our only role. Without the institutions on campus, we don't have a reason to exist. And so our employees care deeply about what is happening on campus, and that at the end of the day we have all of the tools and facilities in place to support the academic mission of the campus. And so our folks are, you know, they're concerned because they want to make sure that our community feels safe, that they're comfortable, that their workspace is ready for them, that their classroom's ready for them, and that's our #1 priority.
Saying that, what should students and staff know? Obviously, at time of recording, it is August 8th. Staff returns on the 12th, and I believe students return on the 19th.
Correct.
What should they know?
They should know that we, despite the concerns about the health issues in the West classroom, that we have no reason to believe that there is anything unsafe about that building or any other building on campus. We would not intentionally put anybody in harm's way on campus. It's against what our mission is. Our mission is to support the development of our students that are coming on campus, and our staff play a key role in that.
Was there anything in the first town hall that you thought wasn't as transparent as it could have been, or further information that should have been provided that wasn't?
I don't think there was anything that wasn't provided, but I do think that the asbestos concern is in some ways misguided. I think that folks truly don't understand asbestos or how common it is. And on top of that, asbestos is not something that's going to cause things like breast cancer. It causes very specific kinds of illnesses like mesothelioma, and the latency period, or onset period for that is 20+ years. So unfortunately, I think that there's some confusion about the difference between sort of hazards in the building, indoor air quality versus asbestos. And you know, asbestos is something I think that folks, they know the word, they think that it's scary, but it's really something that we deal with constantly when we're doing projects on campus.
So, shifting a little bit towards the testing.
Sure.
Of your knowledge, what do tests look like, and what specifically are you testing for?
So there are two independent firms that are testing the same types of testing to be able to benchmark against each other. And they are looking at a wide variety of indoor air quality concerns or hazards. They're testing for radon, they're testing for ionizing radiation, they're testing for volatile organic compounds, heavy metals and things like that. And how that testing looks is, small type of test devices that are collecting a finite amount of air supply over the course of a period of time. And then obviously things like radiation are tested for with different counters and instruments like that. That type of testing is not uncommon. We've done that in other places on campus when we've been getting ready to do a project or had some type of a concern. But we really have tried to get out of the way and allow those professional firms to come in with their certified staff and do these examinations and really interpret what the data means for us.
So going forward, talking about the future, will removal and remediation tactics change going forward?
No. There's no change to our approach when it comes to things like asbestos or testing paint for lead, things like that. We really have been following best practices when it comes to that. We have certified staff that work with us constantly on that. And I'm very comfortable that the safety approaches we've been taking towards managing our facilities are adequate and will continue to be adequate.
So finally, what are the short-term goals for AHEC, for the campus, and MSU Denver, as far as you're knowledgeable of? What are the short-term goals, and what are the long-term goals?
So the short-term goals are to give folks peace of mind that their workspace is safe. We don't have any reason to doubt that, but this will hopefully sort of put a punctuation on that. And obviously the biggest short-term goal is to commence classes on Monday, the 19th. That's the goal that everybody's marching towards. And the long-term goal is just to really hopefully maybe educate people about things like asbestos and the myths or the FAQs related to it, to help folks understand that it's a very common compound that's in buildings where they go to the doctor, in buildings where they go to church, in buildings where their kids go to school, and that in and of itself asbestos does not need to be feared.